As parents, witnessing our child experience a seizure can be one of the most alarming and frightening moments. It is completely natural to feel a rush of fear and uncertainty, wondering what to do and when to seek immediate help. Understanding the critical signs can make all the difference in those stressful situations. A child's seizure becomes an emergency, requiring immediate medical attention if it lasts longer than 5 minutes, or if your child has trouble breathing or turns a bluish color. It is also an emergency if they are injured during the seizure, if they have another seizure soon after the first one without fully recovering consciousness in between, or if this is their very first seizure. Additionally, any seizure occurring in water, such as during a bath or while swimming, should always be treated as an emergency. These specific situations are considered medical emergencies because of the potential risks involved. A prolonged seizure, medically termed status epilepticus, means the brain is experiencing continuous abnormal electrical activity, which can, in rare cases, lead to long-term neurological complications if not stopped promptly. Breathing difficulties indicate a critical lack of oxygen to the brain and other vital organs. Injuries sustained during a seizure, particularly head trauma from a fall, requiring urgent assessment to rule out serious harm. When a child has multiple seizures close together or experiences their first ever seizure, it signals that an underlying and potentially serious cause needs immediate medical investigation to ensure their safety and well-being and to prevent future occurrences. During a seizure, your immediate priority is to ensure your child's safety and minimize the risk of injury. Gently guide them to a safe spot on the floor, away from any furniture or sharp objects. Place something soft, like a folded blanket or jacket, under their head to provide cushioning. Carefully turn them onto their side. This specific position helps keep their airway clear and prevents them from choking on saliva or vomit. It is crucial never to try to hold them down or attempt to put anything into their mouth, as these actions can cause more harm than good. Start timing the seizure from the moment it begins and carefully observe any specific movements, changes in their breathing, or alterations in their skin color. This detailed information will be invaluable for the medical professionals when they assess your child. While all seizures are concerning, understanding the context can sometimes alleviate initial panic. For instance, febrile seizures are a common type often triggered by high fevers in young children and typically resolve on their own within a few minutes. However, even with a history of febrile seizures, if any of the emergency criteria we have discussed are met, such as prolonged duration or breathing issues, immediate medical attention is still essential. For children with a diagnosed seizure disorder, working with your pediatrician to develop a personalized emergency action plan is incredibly empowering. This plan outlines specific steps to take, including when to administer rescue medications or call for emergency services, providing both you and your child's caregivers with clear guidance and peace of mind. Ultimately, your ability to recognize the specific signs that elevate a child's seizure to an emergency is paramount for their immediate well-being and long-term health. Swift and informed action, combined with calm observation, empowers you as a parent to provide the best immediate care and secure timely professional help. Remember, when you are in doubt about any seizure, it is always best to err on the side of caution and seek urgent medical advice to ensure your child receives the comprehensive attention they need.